Oh yeah, so to give us his perspective on how we need to keep conducting ourselves and improve, we've got Professor Anthony Emeribe, who joins us from Abuja. He's a former registrar and CEO of Medical Lab Science Council of Nigeria. He's a member of the New York Academy of Science. Good morning, and thank you for joining us today on the program, sir. Well, looking at how we are handling this, particularly from the medical perspective, what's your impression of what you've seen so far?
Yeah, thank you very much. Impressed with what is happening so far in terms of response at the various levels. The awareness is growing. The fact that Nigerians are now realizing really that coronavirus is here with us. The fact that government at various levels, state governments and the federal government have also released a number of guidelines as to help Nigerians cope with this scourge, the pandemic of COVID-19, as it were. However, we need to look at the situation we have in the country in terms of the system we have, particularly as regards diagnostic services in the country. The present situation we have calls for urgent need to improve on the facilities at the various levels. Diagnostic purposes, primary level, secondary level, tertiary level, and of course, the reference laboratory level. There is still room for improvement and enhancement in these areas, considering the central role of medical lab services in disease management and containment.
You know, for quite a number of people, in fact, even this morning, you see some dailies reference that insufficient facilities, talking about the health sector now, the system that we've got here, can ruin our efforts, our containment efforts at some of this. Do you share the same view?
Yeah, overall, that's what I say, that the facility, we need to improve the facilities we have on the ground. Obviously, there's room to enhance the facilities we have, particularly for medical lab services sector. There's a lot to be done in those areas in terms of infrastructure, in terms of equipment, in terms of having the right caliber of personnel working in giving out, generating results, and then issuing out results of lab tests. As you do appreciate that, I mean, the mantra is testing, testing, testing. Who does the testing? How is the testing done? What is the quality of the test results? How useful are they? And all that. So for that to happen, we have to have the right infrastructure, we have to have the right human resources, we have to have the right equipment, reagent supplies, ensuring there are no stockouts, etc. So yes, quite a number of things have been done so far, but we still have some gaps in terms of medical lab services, ensuring that they are where they ought to be at this point in time.
Prof, can you, in the light of what you just said, especially about the lab services and all, perhaps there is a need for people to understand the character of the virus that we are talking about at this time.
Yeah, the virus we're talking about this time, the new coronavirus, the agent causing COVID-19, yes, we've already, I mean, a number of information is already out there to the public on the type of RNA virus causing this scourge, as it were. It's a relatively large viral particle, envelope-associated virus. It is a cause of basically pneumonia more than flu. Social distancing is what is required because the particle cannot stay for long in the atmosphere. It settles down on surfaces and can last there for a number of hours. So it's recommended that disinfection is applied It's also recommended that face masks are used and made commonly available, as it were. What we are realizing now is that personal safety equipment could be a challenge. Supply lines could be a challenge. I know that right now there has been a rush in getting these, the hand gloves, the face masks, that if you go to most shops now, you hardly will get the masks. And where you see them, they're rather expensive and out of reach of the poor. So that will be an area we have to look at. Every Nigerian should have access to personal protective equipment. Hand gloves, face masks, sanitizers, to aid social distancing, which is being advocated. So the virus is what can be contained if we have this on ground. And of course, the behavioral attitude of the public is also very, very important. It is important that Nigerians strictly follow the guidelines released by government. It's important that we avoid large groups. It is important that really we cancel all forms of gathering, particularly when they are not crucial. And of course, it's been said that gatherings of more than 50 should not be allowed at this point in time. And as a matter of fact, in some places they have already said 20. Stay indoors, more or less. I'm happy with the directive that workers below 12, grade level 12 and below should no longer be going to the offices. I'm happy with the schools that have been closed. I'm happy also we have to extend these to areas where we have a lot of gathering. The motor parks, some of the streets, the market, what do we do?
Prof, one moment,
the
Prof.
challenge is essentially
Just
that
one
most
moment.
of these...
One moment, Prof. There was something you said earlier about face masks. The information we have hitherto was that if you are not sick, if you are not having any symptoms whatsoever, you do not wear the mask. And the assumption at that time was that if you wear a mask, it means that you already have symptoms. And you're saying now that whether you have it or not, we should wear the masks? Can you clarify?
Yeah, thank you, please. Yeah, you need to wear the mask to protect yourself. All right, you need to wear the mask to protect yourself. As you know, when individuals are close to each other and talking, one who is infected can easily transmit the virus to the person close by. So with the mask properly worn, that limits that. You know, we have situations where we have a lot of people staying in the lift, in the workplaces, as I said, in the market, in the social gatherings, where people are close to each other and talking to each other closely. Masks will help that. Masks are not only for those who are sick. Masks are for everybody at this point in time to help us limit this scourge, particularly when you have to be outside of your house. It's important we make the mask available readily for all Nigerians.
And the thing about the masks, Prof, is that because, I mean, some, for the sake of having a mask, they have just one. And they keep using that one. That's not how it's supposed to be used, isn't it?
Yeah, thank you very much. Masks should be available to everybody, not just one mask, but several masks. Because you don't use the same one every day. At the end of each use, you discard. Okay? Then have fresh supplies. So masks should be readily available. Every family should have a pack of masks, particularly to be used when you are outside the house and when you are going to meet other persons. So we should develop that habit. We are not used to it. The time now has come with what we are seeing in some parts of this country, Lagos, Abuja, and all that, to start having that awareness of having masks available.
Well, Prof,
the challenge
you know,
we have is that they are really...
The thing about this, Prof, pardon me to butt in, you know, sometimes people hear what they hear or what they want to hear. And about this mask and the equipment, which is every Nigerian should have, it's going to be a nightmare situation because you have the frontliners, first responders, the health practitioners who need, perhaps if we could say, need them most, if not all the time, because they are consistently attending to people. So if you say everyone should have that mask, don't you think that that's going to put a lot of pressure on those facilities, and it may eventually deprive those first responders, the medical practitioners, access to those facilities? Can you hear me, Prof?
Yeah, thank you. Yeah, thank you very much. Yes, obviously, the health practitioners ought to have limitless supplies of the safety equipment, gloves, face masks, etc. Lab coats and all that, shoes and boots and all that, goggle, etc. But the members of the public who are in places where they are meeting a number of persons need the face masks. I mean, even if you go to some of the offices now, I've started seeing them wearing face masks in the banks and all that in other places. They are now wearing face masks and wearing hand gloves and so on. Those are things others need to emulate. There is no doubt that proximity, when persons are in close proximity, the chances are there to transmit the infection. Realizing that apparently healthy Nigerians could carry the virus, no showing the signs and symptoms, and mingling with others. So the way to avoid that is to wear masks. The way to avoid that is to have hand sanitizers, have things to disinfect where you are walking, where you are interacting with other persons, make sure the environment is clean and all that. So we need, sanitation is very, very, primary at this point in time. We have to bring it to the forefront. So the face masks are important and should be made readily available. So
there are reports, they make the rounds that there are persons who maybe contacted certain persons who have exhibited some symptoms, and there are some other persons who ought to self-isolate or reach out to the NCDC. Some of them are evading all of those. They're not subjecting themselves to tests as it should be. Tell us, what should we expect? How are these tests carried out? What are the stages so that people don't get unnecessarily scared or peddle wrong information about how those tests are carried out?
Yeah, thank you very much. Awareness, advocacy is very important. Awareness as to what it is all about, what infection is all about, and how to go about it is important. And of course, I can tell you that we have a number of these in the social media, on the television, on radio, on newspapers, etc. It's for Nigerians to get, aware of all this, read, as a matter of fact, to know about what the COVID-19 is all about. As to the testing, really, yes. You talked about those who are coming into countries where they are likely to have had a contact, refusing to get tested, and then, of course, how is the testing done, and what's the profiling, etc. NCDC have been on tops in this direction, ensuring that those who need testing get tested. Obviously, any Nigerian that have the exposure, the signs and symptoms, and is supposed to, of course, exclude himself from mixing with other persons and seek for testing. For now, the test being done is real-time PCR. It's a nucleic acid testing to pick up the particles of the virus. Highly sensitive and reliable. Various new other tests are coming up, but most of these have not been certified and confirmed to work in our community. Minus doing the PCR, there are antibody tests, there are antigen tests. How good these are is a different matter. And of course, if and when we have to accept for testing in the country, we have to make sure they pass through due process of certifying that they work and that they're effective. So for now, it is the PCR that is being used by NCDC and associated laboratories. Obviously, we need more laboratories capable of doing this across the country. We have been told where the labs are, and there is need for upscaling to ensure that really we need to have these tests in all the geopolitical zones and possibly all the states, as it were.
Prof, is there a way for people to know, because one of the challenges of COVID-19 is that the symptoms don't start showing immediately. If anyone has it, the person doesn't know he has it until about 14 days or thereabout. So on the one hand, what are these symptoms that begin to show to anyone? Because, you know, there is naturally a panic mode that once someone coughs around you or when someone sneezes around you, you begin to panic that maybe the person, you know, already has COVID-19. So could you tell us what are those symptoms that would make it clear that indeed this is a suspect case?
Well, the commonest is fever. It's high up there in terms of the rate of signs and symptoms seen in the person that is supposed to be having or suspected case of COVID-19, cough, sore throat, non-productive cough, sore throat, and of course, general body pains and weakness, and all that. And of course, once one starts having these signs, you can see that what I've just said, you can see in a number of other diseases. I mean, somebody who has malaria will have fever. Somebody who has many other infections, even common cold, could have a fever, could have a cough. But I mean, COVID-19 cough is non-productive. All right? It is more of pneumonia, all right, affecting the lungs. Yes, as rightly stated, for 10 to 14 days after infection. Normally, most of these infections will have the incubation period in which the signs and symptoms have not come up. And of course, could be a period where such a person can still infect others without knowing he or she is already infected. But once the signs and symptoms start coming up, the best thing to do is for such a person to sit at home, remain at home, have that level of discipline not to go out. Very, very important. We still see a lot of people in the crowd coughing, a lot of people in the crowd having sore throat and complaining with general body pains, and of course, fever, which the temperature reader that is commonly available in public buildings can now pick up. But that is not just all that. So once Nigerians start having fever and start having cough and start having sore throat and start having general body malaise and all that, they should stay at home. Staying at home is one thing, and of course, reaching the hotline of NCDC is another thing.
One quick clarification,
very important that
one quick clarification
should reach the hotline for.
One quick clarification, Prof. You said
yes,
a cough would not be productive. What do you mean when you say unproductive cough?
Dry cough. Yeah.
Okay. All right. So you recommend that anyone who has these symptoms should stay at home. At what point should people call on the NCDC? We understand that a number of people have been trying out the call center of NCDC, and of course the DG of NCDC told us yesterday that they had a barrage of calls. They have a barrage of calls on a daily basis running into thousands. So at what point would you recommend that anyone should call on the NCDC or any of these isolation or treatment centers?
Yeah, having the signs and symptoms, and then of course how long that has lasted, these have lasted, is very important. Obviously, NCDC, we expect a lot of calls going to NCDC. There's a lot of fear in the atmosphere presently, so they expect those calls, and I'm sure NCDC is coping and will also increase its ability to respond to the calls and give the right advice to whoever is calling. Anyone having those symptoms, not just one of them, I said fever, I said dry cough, I said sore throat, I said body pain and all that. When these come up and they persist for a couple of days, at that point, I expect that person should reach out to NCDC for proper guidance and advice. And obviously, NCDC, when such person reach out to NCDC, then if the NCDC considers it is appropriate that a blood sample of such person should be collected, arrangement we made to have the samples collected and tested.
Speaking about the health professionals, I mean, yes, we talk about them in passing most times, but the thing is, well, they are the ones who we look to. They are the ones who are in the front lines. They are the ones who should provide some of this containment strategy, the treatments, and the rest of it. But we also do remember that time and again, they're usually going on strike because they just feel all is not well, they're not being properly handled or catered or attended to by the authorities who should be paying their emoluments and all of those benefits of theirs. And the big question now is this, look, assuming, because now they say expect a lockdown, do you think that we can withstand this? Should it exceed or get to the stage perhaps larger than what it is now? Can our facilities withstand some of these things? Because some of these health practitioners, when we speak about safe distancing, some of them are poorly paid. Can we withstand it as we currently are?
Yeah, we have a challenge really. Yes, the health practitioners are doing a lot on their own. They are trying their best within the circumstances of what is available on the ground. I think I started saying that we need to improve on the health system. You know, health is key to any environment. Health is at the base of the economy of any society or any nation. And this is why, if we want a healthy workforce, we need healthy health practitioners. We need healthy practitioners that have reasonable level of work climate in terms of what they work with, in terms of how they are remunerated, in terms of their job specifications and conditions of service. These are very, very important. That's why I say that within the scope of what we have on the ground, the health practitioners are doing very well, but there is room for improvement. Obviously, we don't have the best of the health system presently. And health systems are not what you build overnight. They take time to build. But what we expect is to have that consciousness of having a strategic plan to say in 2, 3, 4, 5 years, this is where we want our health system to be. And we work towards that, and we can achieve it. I mean, this is why the United Nations recommended a minimum of 15% of the budget of any developing country to be used for the health system. So we ought to have to work towards that to ensure we have the right health system in place. And as I said, most of the public visit the primary health care center. That's the first line of contact. What is the situation of our primary health care centers presently? What is the situation of the general hospitals across the state in most of the states? And what is the state of our teaching hospitals and specialist hospitals? I'm sure we can do a lot still in these areas. And even when you talk about the health system, I think the most affected really is the lab services, as I said earlier on. You realize that the lab sector in many institutions are forgotten and only remembered as an afterthought. Even in the private sector, you realize that the lab could be where was meant to have been a kitchen initially. Labs are important because we have to keep repeating that. Most of the decision making affecting the patient, over 70% of the indices for managing such patients come from the laboratory. Whether it is in terms of diagnosis, whether it is in terms of monitoring, whether it is in terms of management of the patient, treatment, in terms of prognosis, in terms of discharge, in terms of number of days the patient even stays in the hospital, to a large extent, over 70% depends on results from the laboratories. When the results from these laboratories are not accurate, they are not reproducible, they really is a cause for concern for the physician, it's a cause for concern in terms of wastage of resources, in terms of how the patient gets optimum care in that institutional situation. So we need to be conscious about the lab when we are planning for the health system.
All right, fine place. That's a good place to let it go,
COVID,
Professor.
2014, we had it.
All right, Professor. We appreciate your thoughts this morning. Professor Anthony Emeribe is the former registrar and CEO of Medical Lab Science Council of Nigeria. Thank you for your time this morning.